Hello, everyone. Thank you for joining us for today's webinar. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CU content with over 200 speakers, 700 courses, and 3,000 hours of CE. Today's webinar is Clinical Success for Pulmonary Heart Disease, Polycythemia, Purpura with 40 plus years of herbal mastery with Dr. Jimmy Chang, sponsored by Evergreen Herbs. Dr. Chang has over 40 years of concentrated clinical experience, treating over 500,000 patients, specializing in differential diagnosis and herbal prescription. Today's sponsor, Evergreen Herbs, is the perfect partner for Dr. Chang, as he has strictly purchased herbs directly from them for the past 30 years. His pharmacy has over 150 single herbs and formulas combined. If you're interested in starting a pharmacy just like Dr. Chang, you can order Dr. Chang's Evergreen Herbs webinar special and receive 15% off on the herbs he currently uses in his clinic. This special includes formulas such as his famous astringent complex, herbal ABX, and various classic formulas and single herbs. I'll send a link in the chat room for you to check out. This class will be presented in a similar fashion as his previous classes, so I will explain Dr. Chang's webinar for our new students joining us today. Dr. Chang's formulas will be listed in the Fang Jia Fang style, meaning formula plus formula. In addition, he will write a percentage after a formula to indicate its ratio in the prescription. Dr. Chang typically prescribes his patients 100-gram bottles or 150-gram bottles if they are not local or if the disease is chronic. Dr. Jamie Chang, a widely known figure in the TCM community, has been instructing at eLotus for the last 2 decades, contributing to a substantial array of courses on our platform. For those interested in more pulse diagnosis, we suggest also enrolling in Dr. Chang's comprehensive Pulse Energy 1, 2, and 3 course series for foundational pulse diagnosis knowledge. For our new attendees joining us, let me familiarize you with our webinar room. Please set your chat from host and panelists to everyone so that everyone can be part of the conversation. To ask questions during the webinar, please use the Q&A box so that the questions remain separate from the chat room. And lastly, the quiz. The quiz for CEUs will be available by the next business day, late afternoon, for everyone with qualifying attendance. Now, let's get started with today's webinar and welcome Dr. Jimmy Chang.
Okay. Can you hear me now? Hi. Hi, guys. It's me again. Today, we're going to have a very interesting, the echo is too strong. Subject here. Okay. Oh, let's close this one. We'll be talking about pulmonary heart disease, which is very popular and somehow is kind of interesting. It's hidden behind a lot of other symptoms and causing a lot of discomfort in the chest, but actually it's the pulmonary stuff. And the reason for that can be very tricky. We'll be explaining to you today in a very interesting way. The second one is polycythemia and purpura. They are all very popular. Yes. Window P. Okay. I'm sure you got a lot of interesting information today. In addition to this topics, we'll be talking about my second pulse system, which is very useful. Actually, before we start dealing with any kind of a disease or discomfort or something, when you treating patient in your office, when you can tell what kind of the patient constitution is like from the patient's appearance. That's very interesting, and that makes a lot of it easy for your treatment plan. How do you decide to treat this person? How do you ignore all his major complaint and all the major symptoms and deal with the root of his problem? That's what I do every day. I look at the appearance, and I have a good idea already forming in my brain that what to use and what not to use. And you can choose the corresponding prescriptions. So what I'm trying to tell you is do not be misled by the patient's wordings. No matter what they say, I have this, I have that, never mind that. We have to find the root for his problem. Then we deal with it, that you can get the best successful treatment results. That's what I've been doing for the past 45 years. In other words, decide you decide your treatment approach by the body types, and of course, pulse and the blood pressure. Let me explain more to you. It's very important because I did get a lot of complaints from my students. I'm saying, how come my treatment didn't work? I said, you're neglecting the most important things is their body type. Their body types. Because when I saw their prescriptions, I said, hey, you're misleading. The patient's wording give you the wrong idea. Oh, I have a back pain, then you naturally prescribe this. Oh, I have a headaches, and of course you prescribe this. I have a very interesting case lately in my office, a young lady that's about 50 years old, something. She's very skinny, and her major complaint is headaches. No matter what kind of headaches medicine I gave her, nothing worked. But she persistently come to my office and ask for more treatment. Interesting. I gave her 川芎茶条散. I gave her USA 1. I gave her 5 yellow, which is supposed to clear the head of her, the heat out of her head. Nothing worked. And finally, I gave up all the symptoms. I start following her basic problem is the kidney yang deficiency. She's very tired, very weak, and very low in hormone. So I gave her the right one, my kidney yang combo, the Yong Gui one, and the 6 C's, and the 鲜毛 and the 威灵鲜the 营养货. There's 2 kidney yang tonifying agent. This actually is for hormonal balance. Then her headache's gone. Oh yeah, I'm so amazed by myself too. That was very, very interesting. So she's very pale and very weak and kind of elderly in low hormones. So I treat her with the hormone treatment, and it worked. It surprised me too. It's interesting. So do the treatment by watching their body types. That's very, very important for your future success. And look at this. This looks neutral, nice, good body. And this weak and type, there's a weak and pale. And this one is even weaker and more anemic. And this the strong. Oh, don't be fooled by his big body. He might be very low in hormone testosterone from the pulse. And this elderly gentleman is definitely very weak. But maybe he might also have a big high blood pressure from the kidney deficiency is possible. So don't be misled. And this young guy looks pale, but might not be very weak. Look at this big, strong guy. His energy may not be good. And look, this little chappy lady, she must have a lot of dampness and the blood stagnation. And this one is more dampness, more stagnation. And this construction worker definitely have a lot of dead blood in his body from previous injury or work injury or whatever in this. And this guy might have a little sports injury. So by looking at their appearances, then you can now know what to give. If this patient has major complaints, I'm so tired, weak, no matter what, do not give him 十全大补, right? Because it will cause more trouble, but we can use something else. I'll tell you later. And this lady, oh, my doctor, I'm so pale, I'm so tired, please help me. And if her or his blood pressure is very high, then there's another story. It's a kidney deficiency. We cannot give her any 十全大补, even they're very, very tired. So the blood pressure measurement is also very important, combined with their experiences, and we can have a very useful, helpful treatment plan, right? How to substitute for ren shen in patient who is skinny young? I never use ren shen. In my whole life doing treatment, I never use ren shen alone. There's a formula called ren shen yang rong tang, but actually it's very, very minor a portion of the ren shen in there. And actually I do not use it until, well, it's not until, unless this young lady is very pale, anemic, and with a very low blood pressure, I would use ren shen yang rong tang. I do not use ren shen as a single herb. Patient with skin. Yeah. Okay. And, yeah. Well, we have to make the decision despite of their major complaint. Oh, I have a joint pain. Doctor, I have a neck pain. No matter what, I don't care. I just try. The first thing I would do is to decide their body type. Is a Qi deficiency with a low blood pressure? The heartbeat rate is low. Yang deficiency is even lower with a very freezing cold palm. When we take the pulse, we will inevitably will touch the patient's palm, right? Some of them are freezing cold. Some the lady I talked about earlier about her headaches, her palms are like freezing cold. So in the beginning, I was using 川芎茶调散 something because her pulse was jumpy. And I use USA1 because USA1, I invented that formula for all kind of headaches. But nothing worked until one day I feel her palm is freezing cold. It's freezing. I'm not exaggerating. It's freezing. So I just simply I decided to change the treatment plan by giving her kidney yang combo. 六子右归二仙. Oh, it worked. It's really not even one page of any textbook would tell you that young tonifying herbs will cure the headaches. And then neutral, that's very rare. Phlegm and dampness, and chubby person with let's watch their blood pressure too. In deficiency, long-term exhaustion, working too hard, didn't get sleep. I have a lot of patients who they're working in a casino. They're dealers, but they have to work from like 11 o'clock to the morning next day. So they spend all day, all night in their dueling cars, standing and with no rest. So they are very deficient with a lot of leg pain. Whenever there's a leg pain, I would give them something like a young tonifying. Qi stagnation, doesn't move. The heartbeat rate might be very low. Damp heat may be high. Maybe this combined with a hyper thyroid blood stasis. I'll be talking about a lot, this one. And it's very easy. You can, by looking at their face, people with blood stasis, the stagnation, they have the very dark appearance on the face. And this is something else, got nothing to do with the body type. It's from external problems. So before you decide to prescribe the herbs and formulas, you first must decide how to clearly identify their body types. Huh? I rely on this kind of a decision-making condition a lot. And the treatment of this body type, huh? You can clear his, oh, this one, this guy, even they have the same problem like a body aches or a stomach problem, the treatment will never be the same, right? If this elderly woman has a back pain and if the young girl has the back pain, the treatment will be totally different. And this difference between them is so obvious. You couldn't make any mistake, right? Okay. Okay, next time. Oh, we'll be talking about this a lot, the Bagua. Bagua pulse is very interesting. Mostly is this one. Today we'll be talking about the lung and heart. This one, actually the lung is like this. Weak, strong, strong, in 3 levels. Huh? If you push down a little bit, and when you touch the skin, the surface is very, very weak, no rebound. When you press down a little bit, the rebound becomes stronger, and then push down all the way to the bone, the rebound becomes more stronger. So in this case, this we call bronchitis. This pulse usually appears on the 寸关尺, on the yang wei area. Yang wei is the 8 extra meridian pulses. Yang wei is the lung, the lower part. It's not the upper respiratory system, not the allergy, not the a cold or runny nose or no, nothing. It's down there. It's like a bronchitis. So they have cough. But not everybody coughing with the who is coughing or been coughing for a while will have the pulse like this. Not necessarily. Sometimes the cough was from other reasons. We'll be talking about that today. Huh? So today you have to learn this one, this pulse on the right cun or the right yang wei. Weak, strong, strong. Then this bronchitis. I have a very good bronchitis combination waiting for you. And for heart, it's like this. Strong, weak, strong. It's weak, huh? But usually this one is enough. This third one is very rare. I don't understand why. You don't see it very often. This one is very popular. This one is the most popular one, this kidney. Kidney, actually, this is the middle, right? The middle one is very strong. So usually when I feel a pulse, this pulse can be anywhere, left, cun, guan, ci, anywhere. Whenever I find a pulse like this, I will tell them, hey, your problem is all in the middle. In the middle part of the body. It's either gallbladder, stomach, liver, and the back and the kidney. Anyway, they'll have back pain, definitely, in the middle and almost like in the low back. This. And their upper part and other part, lower part are not communicating. So they'll be very stressful, very tired, and very lazy, and very low in motivation, and this is very bad. So we can do it. We can cure his problem by the condition like this. But today we'll be talking about long mouth. This mouth is interesting. So whenever I saw a pulse like this, I'll say, you have a little bronchitis and something in your mouth. They always respond, yes, something in there. Could be anything. You just try it. You will see a lot of very interesting cases in there. Huh? So try to find those. And this one is very popular too, stomach and hand. And this is most popular, the spleen. This, like I said, weak pulse. If the pulse is all weak from 3 levels, that means constipation and bad absorption. Why the weakness means constipation? I'm not too sure. And maybe that means the digestion system are too weak to push the dirty things out of the body. So pulse with that, like this, definitely means constipation. Huh? And actually, you can verify all those problems on the ear signs. You've been with us so long, I'm sure you're very capable of reading the ear signs, right? The ear is your teacher. He can be there to teach you everything about this patient. Isn't that interesting? Okay. And we must, this one is very, very, very important. Huh? The blood pressure analyze the blood pressure and heartbeat rate is a very important signs indicating the body type. Systolic, 150, or sometimes I have people with some 180. They don't feel anything. That's the problem. In your book or in your school, your teacher will teach you how to make the differential diagnosis to make the treatment plan. You have to follow the patient's symptoms and chief complaint from their mouth. But even the patient with even over 200, I just tried and ask him, how do you feel? You feel headache? No, don't feel anything. But the blood pressure is high. It's there. Very strange. With such a blood pressure, not even a headache. He said, no, I don't feel anything. I don't feel anything uncomfortable. So the textbook might not be very accurate. Huh? Something like this with heartbeat rates is definitely what? Excess heat, right? So no matter what, do not give him anything to tonify his body, because maybe this patient's major complaint is, doctor, I'm so tired all the time. Please help me. Okay, we can help you, but not by giving you any 十全大补 or something similar. 黄芪健中汤. No, don't do that. This case will clear the heat first. Can use my blood pressure combo, which is very effective. So the type 1 is excessive heat. A guy like this is possible. Type 2. Systolic 95, 60. Okay. You're free to use anything. You can use the kidney yang combo. You can use 十全大补汤. You can use 补中益气汤. Is excess or deficiency? Definitely deficiency. Cold. So if, let's talk about it. If the patient with this blood pressure, like her, so weak, so tired, her major complaint is, hey, I have inflammation in my joints. I have autoimmune deficiency. My knee joints hurts a lot, and my back hurts a lot. With a weak lady like this. So what do we do? To give him needles, acupuncture, of course, joint pain. Oh, the joint is swelling. You can see it visually. You can see it is swelling and painful when touch, or it feel hot in the joints, something like that. So obviously it's inflammation, but her nature, the nature of her body is like this. So, of course, needles are fine, but needle will work in a while, but eventually it will fail because her body is too weak to accept needle stimulation. Maybe temporarily, I feel the pain is better, but eventually the problem will not go away and will become worse. So if for kind of this, with the chief complaint is mucho dolor, a lot of pain. We do not deal with the pain only. We deal with this by giving him 十全大补. I give 十全大补汤 mostly to cancer patients, pain or not, but for the 正气, for the energy and for the immune system. So for this case, no matter what, her period pain, even her headaches, we will give him 十全大补, something like that. Okay. Type 3, 100 and over a little bit, maybe a little higher, but the heartbeat rate is 65. Slow stagnation. This patient is not on blood pressure medication. Majorly, it's not on the blocker, not on beta blocker. Beta blocker will slow the heartbeat rate, and so it doesn't count. But anyway, still give him a very bad situation, but it's not on blood or thinner or something. Pulse diagnosis with blood stasis is excess or deficiency. It's neither. It's not that kind of problem. It's just circulation. Heat or cold, nothing. This is slow. Slow means stagnation, so something like this. And if you do this cupping in your office, you can directly show the patient, look at that. My diagnosis was correct. You have a lot of blood stagnation in your body. Look at your body. You can see for yourself. See the stagnation that comes from it can be from sports injury. But interesting, look at this. This one is so dark, and this one is comparatively normal. Look at this two. These two cups are so close to each other, like this. See? So close to each other, and the color is so different. This one is so dark and with the blood stagnation. Look at this. And this one is comparatively normal. Isn't that interesting? See, this one is dark and this one is white. So much, the difference is so obvious. That means certain part of his body, the channel or something, is stagnant, but some of the area are not. This is the lung area, and this is also the lung, but this is the chest, mostly the chest. So if you have time to do the cupping in your office, and you can see a lot of interesting results by doing that. So then you can verify the condition, then you're free to give some blood moving medicine like 生痛逐瘀汤, 正骨紫金丹, or even you can give him some kidney yang deficiency. A little bit, but not too much. But majorly it's the stagnation. Let's clear the blood first. And I promise you'll get good treatment result, and your patient will be more and more and more. Type 4. Systolic low, diastolic low, very low, huh? But the heartbeat rate is fast. That's deficiency. That's a long-term deficiency, the result of long-term deficiency. So actually, this patient needs is food, meat, red meat, and zinc, more than medicine. But anyway, they're here, we'll give them something. Is excessive deficiency? Is deficiency, but excessive heat from the deficiency. So in this case, oh, my neck hurts, I have headaches, I have a back pain, I have a knee joints and something, I cannot sleep, I don't have any appetite. No matter what, don't follow their complaints. You follow this, and your pulse, and the ear signs. And finally, you take their complaints as reference, but we deal with the root of their problem. That's, you can become a very successful practitioner, okay?